Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Jayme, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Welcome, guys, to another episode of MedTalks. I am Jayme, Director of Community Outreach and Communications at Grace Med Health Clinic. I am here with Crystal and Jayme from FosterAdopt Connect. How are you guys?
We're doing great. Thank you.
Good. Thank you so much for having us. We're happy to be here.
Thanks for making time to be here and talk to me about FosterAdopt Connect. Talk to me a little bit about what the organization is and what's their mission.
So FosterAdopt Connect has been around for 25 years. What started as a small support group for foster families in Missouri now spans between 2 states, and we are their 15th location. There's a menu of about 20 services that the organization can provide, but specifically here in Wichita, we're really focused on prevention. We're striving to get partnered with families that might be struggling before DCF has a touch point, and our main goal is to keep kids out of foster care.
Okay. Talk to me a little bit more about the prevention process, or what you're trying to do. Like, what does that look like for people? Like, how do you prevent from people going into foster care?
Well, we do it a couple different ways.
Okay.
One of the great things about FosterAdopt Connect is that before they move into a new community, they really look at the resources that are available already and see where the gaps are that we can fill in. So instead of duplicating services, we are filling those gaps that need to be filled in the community. And so looking at Wichita and Sedgwick County, prevention was an area that could still use some resources. And then we felt like we could really bring something to that. And so we have 3 different programs at our location in Wichita. The one that I oversee is fostering prevention. And again, the goal is to keep kids out of the system, out of foster care, to reduce that trauma. And we do that with the combination of case management and stabilization. So if families are struggling with things like transportation, employment, childcare, housing, all of the big things that tend to be barriers, we connect them to community resources and help them get stable in those areas. And while we're doing that, we use a parenting curriculum called Nurturing Parenting that helps build parenting skills and competence. It looks at different areas such as discipline, appropriate role expectations, creating a safe environment for kids, just lots of different areas to help them build those skills and that confidence so that they can strengthen their family, be the parents they want to be, and get to where they want to be.
Okay. I can imagine. So I used to be a caseworker for like a mental health organization. And I can imagine that when you build a treatment plan, which sounds almost like it, that it takes a while to meet those goals, right? How long does it take for a family to really kind of feel secure in saying, like, okay, I don't need these services further. I've gotten my life stabilized so that I'm able to continue having my family together?
Well, every family is different, so we try to approach it that way and really individualize our plan and our goals to that family. The program is designed to be a year, and over that year, our specialists go in and work with the parents one-on-one about once a week for about an hour.
Okay.
Again, we adjust that depending on what the family's needs are and what works for them. But about a year, and then we offer 6 months of aftercare after that if they want to participate in that. So you're looking at about a year and a half total if they go through the entire program.
Okay. Good. That's awesome to have someone there available for you to assist you through all that. What are some of the biggest challenges that you see families have?
Again, some of those things that everyone sees that I mentioned earlier, transportation, reliable transportation is huge. Affordable, stable housing is huge. Creating a safe environment is kind of a big one. We go into a lot of houses that maybe don't have the ideal environment for raising raising children and having that strong family. And so we really focus on those areas and try to remove those barriers and try to get them where they want to be. And we always say that we walk alongside our families. We want to be an advocate for them, a support for them. We are not there to tell them what they're doing wrong. We are not there to even tell them how to parent. We are just there to help them build those skills, to be an advocate, to let them know they're not going through it alone, because we are there with them.
Right. That's awesome. So you mentioned in Wichita that you offer a lot of like supportive services. Everywhere else with FosterAdopt Connect, what kind of services do you provide?
So in that menu of close to 20, on the Missouri side, for example, they have a program for youth aging out. And that would be an example of maybe the fourth program I've identified that would be beneficial here. They help kids that are aging out with financial discipline and driver's ed. Sometimes they have legal issues that they have to navigate, time management. As you look at Sedgwick County and the large number of kids in out-of-home placements, those kids will be aging out, and they do have a direct impact on our community. So for us here in Wichita, of all the programs that we offer in Missouri, I personally think, and we're striving toward maybe getting that here in the fall to be our fourth program, to essentially kind of be the bookends of the story. So many people are focused on, I think it was 1,500 kids in out-of-home placements last week. There's a great need of adults and organizations to manage that. But if we can swim upstream and get in front and do prevention, but also provide a safety net for those aging out, I believe Wichita deserves the whole package. But as far as the Missouri side, they have a long list of things. They do licensure for foster parents there. That was not an identified need here in Wichita because that's already covered. And so like Crystal said, as the organization has grown into different communities, they do a great job of really researching what the need is to not duplicate efforts. Wichita's pretty saturated with nonprofits, and so it was really important for us, especially to find our niche, to still come alongside and know all the other community partners and be familiar, because our families need those too, but to figure out kind of where our lane is. Yeah.
And Crystal, I think a couple of months back when we first met, we talked about like how Grace Med can really work with you and like how to provide these services and things like that. What other organizations have you been able to meet with while you've been talking to people here in Wichita?
We've been able to we've made some great connections, and it's been amazing to see all the great work that's going on in Wichita. I think some of the main ones are Care Portal. Care Portal has been amazing for us when our families have tangible needs. We've reached out and had them met every time.
Nice.
Family Promise has been really great. We've collaborated with them on some family workshops for their clients, and referred some clients to them for things like rental assistance. CASA.
KCSL has a great family resource center. That one's huge. The Urban League. There are some really cool action teams that are in place right now in our area that are really digging into some of these big topics related to prevention and youth aging out. DCF is present, government officials are present. A lot of people really care about the numbers and kind of where we are, but also really care about putting together a plan to move us forward well.
Yeah, that's awesome. You know, I've noticed that in Wichita, we have so many organizations that are wanting to work together, that are wanting to help people with whatever challenges they may have. And as you mentioned, we're all nonprofits, and so we're all looking for funding to be able to do that. What does your funding come from?
So right now we're 100% funded by a state grant, and that's been renewed for next year. We are working to diversify moving forward in kind of the future of our organization here. We would like to diversify some of that funding. So working with local foundations and private donors, so that we can do more in a timelier manner. So
that's awesome. I get that. I mean, from an organization that depends on federal funds, state funds, private funds, it can be a little bit of a challenge sometimes. So you need to, because we still want to do the work, right?
Yes, because we're doing great work, and it's needed work. So yes, figuring out how to sustain that is definitely one of the goals.
Yeah, I get that.
Sustain it and replicate it and duplicate it, like to scale what we're doing. You know, we have 2 specialists right now, and they usually have a caseload of about 10. So if we're touching 20 families with those 2, what could we do if we had 4 of those specialists? And so looking at what we're doing, where we're planted, and the impact we're making now, but continuing to dream about what more could we do in the future and how would we get there?
Yeah. And I know that earlier you mentioned like maybe like some ideas for the future here in Wichita when it comes to your organization. What are some other ideas that you might have or some goals that you might have with the next 5 years for FosterAdopt Connect in Wichita?
Yeah, continuing to grow our partnership with other community organizations is extremely valuable so that together we can provide a continuum of care and a wraparound service to our families. But also, we talked about fostering prevention. We also have a behavioral intervention program, and that's been replicated. We've trained Ember Hope on that. We've trained DECA, plus we have our own staff, and that goes into the home to work with individual kids who have usually a diagnosis, but extreme behaviors putting the family at risk. The third program we offer is a clothing and hygiene closet, which is for our clients who, again, hopefully have not had a touch point with DCF, but it's also there for any foster adoptive kinship family to utilize. We want to be a tangible support to those families doing the hard work and be a small way to help contribute to them staying stable. We have found with that community through our closet that it's more than just coming for clothing. Oftentimes, these families really see us as a safe place to land. We understand what they're walking through, and they can just be authentic and be themselves and really kind of catch their breath while they're there shopping. And we are becoming part of their trusted support. They know that we're in their corner, and so many people just need that. They need to know that they have people in their corner who care for them even when they're at their hardest moment. So even with the clothing closet, dreaming about how to make that even better. Could we make it look more like a boutique so that the family shopping feel really special? Could we rearrange it in a way that it's designed and it can accommodate more options for families? And so we have big dreams. Of course, finances really affect that. We really in January, we had 4 staff, and now we have 7 full-time and almost 10 part-time. By fall, we may have 10 and 10. We've hit the ground running. We've done a lot in a short amount of time. So 6 months, just looking at where we've come, it's crazy to think, what does 5 years look like? So,
That's awesome.
but it's exciting to dream.
Well, and I think for us, for the program that I manage and for our programs in general, we recognize that, like we said earlier, there are a lot of nonprofits out there. There's a lot of resources. There's a lot of new resources that are coming in all the time, which is great. But we really want to build that trust with the community and with the families so that people know that when they make a referral to us, that they can trust that we're going to follow up, that we're going to do quality work with that family, that we do good work. We just really want to build that reputation in the community that we are a great agency doing great work, and people can trust us when they're sending referrals our way.
I agree. It's something that we always tell our staff is that we could spend a lot of money on marketing. It's all really good. What matters the most is what people say about us in the community.
Exactly.
That consistency, that having that trust, those relationships are very important.
It's huge.
And so I completely understand that. Working a nonprofit, you're not doing it for the money, but you're definitely doing it for the impact.
Yes.
Is there a story that you would like to share that feels like a winning moment for you, without sharing any private information, obviously, that you would love to share with us?
Oh my goodness, we've had several. Let me see. We have one family that one of our specialists is working with, and they came to us. They were really struggling. They have a child with autism, and we're just really struggling to kind of help him and support him in the best way that they could. And so we went in, and our specialist set up a sensory table for him that the parents could use when he needed kind of that time. We were able to get him a weighted vest through Care Portal that helps with his behaviors. And at the same time, we've worked with the family, with the parents on empathy and expectations and some chore charts and just some different things they can work on to help their house run the way they would like to. And then I have a mom that I've been working with she's a single mom. She's got 5 young kiddos, and she is undergoing treatment for cancer. While raising 5 kiddos by herself and still working part-time.
Oh, gosh.
She doesn't really receive any benefits or public assistance. She does it all by herself. And when we came into the picture, she really was doing it all by herself, and she didn't want to ask for help. she felt like she should just be able to do it by herself. And so we came in and we've been able to connect her with a lot of resources to stabilize, take off some of that stress so that she can just focus on parenting and getting herself well. So that's been really rewarding to be able to walk alongside her and improve her situation. Like I said, take away some of that stress.
Yeah. Oh, that's good to hear. I mean, I love that. I absolutely love it. When we're doing all this, obviously it comes from things that we've gone through ourselves in the past, or like a passion or a mission that like a personal mission that we have for the work that we do. What is your reason to continue to do what you are doing? I'll start with you, Crystal.
Oh, goodness. There's so many things. So I come from a corrections background. I worked for the Department of Corrections for almost 20 years. And so I saw the intervention side of things where it was really too late for prevention because they were already incarcerated. They had already been through all those things. So we were on the back end trying to come in and undo all those years of negative things. And it was very rewarding, but also very challenging with a lot of barriers. And so when this came open, it was just a wonderful opportunity to move to the front end and do some prevention so that hopefully we can keep kids out of the system and families out of the system so they never get to that point, so that they can be healthy and happy and safe and where they want to be as a family. And everybody wins when we're able to do that. When we're able to keep families and kids out of the system, that benefits everyone in the community. And so I just love being able to see that and be a part of that, and being able to see parents when they start to build that confidence and those skills and they really feel good about their parenting and what's happening, and we can celebrate that with them. It's just such a wonderful thing to be a part of. So.
I love that. That's awesome. What about you, Jayme?
So my background is mostly ministry and education. So I've taught in the inner city. Our family has also done foster care. I've also mentored several young women who've aged out of the system and were becoming parents themselves. Honestly, when we closed our foster care home in 2018, I was so sad and defeated, feeling like I don't have a social work degree. There's no way I can thrive or make an impact in this world. And I'm excited to have a chance to circle back around and swim upstream, because prevention is truly such a valuable thing.
Well, thank you so much for sharing those personal experiences with me. If people want to support Foster Adopt Connect, how do they go about doing that?
We have a variety of ways. We can have people do drives for us. We have barrels that we can put at different organizations to collect. Currently, we're collecting school supplies, but socks and underwear, for example, always have to be new, and those aren't necessarily a hygiene item, so we're not getting it from other locations. So to do a drive for us would be great. Those barrels also have a QR code for giving. Obviously, a monetary donation through our website is extremely valuable for us. Helping to spread the word, interacting with our social media. We are brand new to Wichita, and like we said, it's very saturated. Just helping us grow our presence here so people authentically know what we're doing is super helpful. And then volunteering. We have opportunities to come volunteer in our Sammy's window, which is our clothing and hygiene. Some volunteers love to be around clients, so there are times to serve during those windows. Others may not feel comfortable with that, so we've set it up where there are also times to serve when clients won't necessarily be there. So there's a big variety of ways to serve. Ultimately, we would love to get to know people who are interested and figure out where their gifts lie and where their passions lie, and then kind of line them up with that. But our biggest thing is getting the word out and then planning for some financial stability that's beyond just our state funding.
Well, I want to invite you right now. We have a back to school resource fair at our Grace.
We are already signed up. I hope.
Perfect.
We are excited. We can't wait.
I'm excited to see y'all there. It's a huge event. We'll be giving away school supplies, all that. So I can't wait to see y'all there, and
we're
so you're able to talk to people in the community who, again, perhaps don't know about this and could see this as a great resource for them.
We are very actively accepting referrals, both for fostering prevention and the behavioral interventionist program. So as people run into families who might benefit from our services, we can take referrals from anywhere, from individuals, from agencies, self-referrals from parents. So we really just want to interact with families and get to know the community and add to what's already here. And just be part of that.
That's awesome. Is there anything that I perhaps forgot to ask or didn't ask that you would like to talk about or discuss?
I think probably one thing I didn't mention when we talked about like 5 years from now, we're slated to open an office by the end of summer in Leavenworth. We'll also be opening in Topeka and Hutchinson, and then hopefully spreading westbound. And so each of those locations, just like us, will be started with the programs that fit the need in that community the greatest. So for right now, Leavenworth will be starting with our BI program. And so I think that that's exciting to think about. We have lobbyists in both state houses in Missouri and Topeka, and we're working closely with the Joint Committee on Child Welfare. Many of those representatives are based in Wichita, and they care deeply about the topics that we're discussing today. And, you know, they're doing their work to understand it, so they're better equipped to make decisions from the top down. And so I think beyond just our Wichita presence, FAC as a whole in the state will have a greater presence in the next 5 years. And some of that is yet to be determined, but some is planned and set to go. So we're excited.
That's awesome. Well, we're in Topeka as well, so let us know how we can help each other out. If people want to listen, or for our listeners, people want to follow either on social media or anything like that, where can they go?
Yep. So our website is just FosterAdoptConnect.org. So yeah, they can look us up. Keep in mind, we have a lot of locations. So if they wanted to look at us specifically, they'll need to toggle through, and most of the lists are in alphabetical. Wichita's at the bottom. So get on down to Wichita, figure out. There's also a help link on there. So if a family in town needs help with something, but they don't know who to call, there are a lot of organizations. They can fill that out, and our team will help filter them to the right place. Whether we can meet the need or another great organization like Grace Med, we can connect them with other places in the community.
That's awesome. Well, Crystal and Jayme, thank you so much for stopping by and for giving me some time to get to know you and your organization. I appreciate that.
Thanks for having
Thank you.
us.
We appreciated the opportunity very much. Thank you.
Thank you. To all of our listeners and watchers, thank you for joining us, and we will see you in our next episode. Bye, guys.